Hey guys, good welcome back. I felt led to do a health video for you guys. Myself, I have rheumatoid arthritis. As of right now, I'm absolutely pain free, though I have zero joint pain other than the joint damage that I've received to my connective tissues from 5 years of severe inflammation in the joints. Other than joint damage or connective tissue damage, I have zero pain. It's officially gone. And I'm going to show you guys why. Okay. Now, again, I'm not a doctor. I'm not a health professional. You guys know the level of research I do. God's already proven to you how I research stuff just from my actions with you regarding the Iraq dinar. I've applied that level of research, how thoroughly I research everything, and I've applied that to my own health, and I'm now absolutely pain free because I research things very thoroughly. So I wanted to share this with you because I felt led to. So here we go. Let's get started. Now, just so you guys know, I'm going to share some things with you that you may not know. And this is going to be a little bit of a longer video, guys. This video could be anywhere from 30 to maybe 50 minutes right in there. So I strongly recommend you watch the entire video. And I'm going to show you some things that I have videos from medical professionals and doctors, things they're stating that I'd like to share with you, okay? So anyway, let's get started. Back when I was originally diagnosed with rheumatoid arthritis, I was pre-diabetic. I cured that immediately. Okay, like it was gone. I'll show you how I corrected that. My sugar glucose levels, which was the diabetes, to now I'm absolutely pain-free because I've corrected my arthritis, okay? Let's talk about how I did it. Okay, first off, everything all the way to cancer, okay? Everything all the way to cancer turns around and starts from inflammation in your gut. So you have to find out what the root cause is and why you have this inflammation in your gut. Let's look at that. The first thing I'm going to do is show you how I did the diabetes, okay, and corrected my sugar glucose. Then I'm going to show you how I did my my inflammation, okay, and kind of what the root cause of the inflammation was. Again, everything starts in your gut pertaining to inflammation. Now, understand, I'm not a doctor. I'm not a health professional, so I strongly recommend you guys. I'm showing you how I corrected my health, but I recommend you guys consult with a health professional. Okay, I'm just trying to give you generalized information, and I've already shared all this with at least a handful of you guys from the Patreon side, and it's helped you guys tremendously. One of the things done is I've done extensive fasting. I'm talking 3 to 5 day fasts, water only. I have fasted 8 times so far this year. I've done like a couple, like 3 days, 2 4 days, and 3 5 day water only fast, and that has helped tremendously, especially people that have arthritis. That has helped big time. It gave them more mobility than they've ever had. Okay, so I just want to stress that to you. Fasting is critical. Now, here's how I corrected my pre-diabetes right here. It's a supplement. I'm going to highlight it. Morenga Oleifera. Okay. This supplement it's a tree. It is the healthiest supplement on the planet. Okay, I'm going to give you some of the benefits of Morenga. It says right here, number 1, it's very nutritious. Okay, here's some of the key things. It's got proteins, vitamin B6, vitamin C, iron, riboflavin, which is B2, vitamin A, and magnesium. Okay, here's some of the other health benefits of it. Okay, it's rich in antioxidants, number 2. Number 3, Morenga may lower blood sugar levels. And guys, it absolutely does. You better believe it does. A couple of you that have diabetes are taking it from our Patreon group, and it's helped you guys tremendously. Okay. Number 4, Morenga Oleifera may reduce inflammation. That's one of the root causes of all this. Morenga can lower cholesterol. Number 6, Morenga may protect against arsenic toxicity. Okay, so it's very powerful. Now, I'm going to put links right here. I've got my links set aside. I've got a whole bunch of links. I'm going to have links for every supplement that I'm recommending, along with the doctor's research and YouTube videos that I'm going to share with you. Okay, I'll have all of this in the video, so all these links will be there, ranging from the doctor's information I share with you to the supplements I share with you. Again, I am not a doctor. I am not a health professional. Consult with your doctor. Okay, don't use my information for your health. I just have to put that in there so I can't get sued. All right. So we studied how critical Morenga Oleifera is for correcting your glucose levels if diabetes is a problem for you. That one's powerful. That completely removed my diabetes just probably within a month or less. Okay, it was a fast turnaround on Morenga with my prediabetes. Next, okay, now with general inflammation in your gut, here's what I found. Most people that have tremendous inflammation in their gut, it's because they have tremendous calcium in their diet. What the calcium is doing is your kidneys are not removing enough of the calcium, which is calcifying or putting plaque in your arteries, okay, causing Morenga, or I'm sorry, not causing anywhere from arthritis to severe types of inflammation in the body to causing gout, okay, causing all these different types of autoimmune diseases, guys. The tremendous research. Now, you know why in your body you have too much calcium or excessive calcium causing plaque and calcified arteries? Research is suggesting it's because you're deficient on vitamin K2. Again, deficient on vitamin K2. One of the things vitamin K2 does, and you'll see this from a doctor in one of the videos I'm going to share, K2 balances the calcium levels in your body. So if you have the symptoms of all this stuff, anywhere from being overweight, being bloated, you have too much gut weight, you have insulin resistance, diabetes, you can't lose weight, to different autoimmune diseases, cancer, which again, all of this is inflammation in the gut related. Okay, most of it's suggestive that you're vitamin K2 deficient, which balances out the calcium levels in your body because you're having excessive calcium. It's not getting removed from your body. So one of the things I found in this is that a supplement called number 1, Chanca Piedra. Again, Chanca Piedra, it's known as the stone killer. It clears out calcium buildup, gallstones, kidney stones, okay, artery plaque, calcified arteries. It clears out that calcium buildup that's calcified or plaqued in your arteries. Again, number 1 says right here, decalcifying arteries, number 1, Chanca Piedra. I take that. I take it in the form of drops and in a supplement pill. Okay, and it works phenomenally. At this time, I am absolutely pain-free. Okay, now vitamin K2 is critical to do with Chanca Piedra. Again, I do pills and drops for Chanca Piedra. I'm going to put the links in those. Now, I'm going to show you some doctors' some videos on both Chanca Piedra and vitamin K2 and how critical it is. Okay, let's get to the first video here, and I'm going to show it to you right here. The first video is on, okay, this one's going to be on Chanca Piedra. I'm going to fire this video up for you guys and get it started. Let me go to a little bit of a different screen view. Okay, and I'll play this for you. Get this going for you guys. Here we are. Again, this is on Chanca Piedra by a doctor.
Are you tired of almost passing out from the pain of kidney stones? Are you looking for things to prevent kidney stones? One of the things you might have come across is an herbal supplement called Chanca Piedra. Does this herb actually prevent or dissolve stones? Who knows? Let's find out.
Hey friends, welcome back to the channel. I'm Dr. Robert Chan. My kidney stone patients often ask me if I've ever heard of this supplement from South America. So in today's video, I'm going to talk about an interesting herb with an interesting name. What you might know as the herb called stonebreaker is actually called Chanca Piedra, or Philanthus nervuri. Stick around until the video to find out if this thing is actually worth taking, or if you're just wasting your money buying this stuff. Chanca Piedra grows best in tropical forests. The herb is used in Brazilian folklore medicine. Chances are you've probably heard that Chanca Piedra can help with kidney stones, but that's not all. It can also help with other stomach-related or intestine-related issues as well. It's often used in teas to relieve stomach problems. Let's look at some of the health benefits and see if this should be a supplement that should be in your medicine cabinet. One of the main things that it's known for is its ability to help with kidney stones. Studies have shown that people who consume Chanca Piedra after doing a shockwave lithotripsy had benefit of having fewer stones. Its ability to alkalinize urine helps it dissolve certain types of stones, like uric acid stones. In a sense, it's a cheaper over-the-counter alternative to prescription medication like uracil K or potassium citrate. The way it works is that Chanca Piedra is thought to inhibit kidney stone crystal formation. It's also thought to help relax smooth muscle like in the urine when you're passing the stone. Let's look at this one study out of the journal Urology, which is the preeminent journal in my field. In one study of 150 patients who were undergoing shockwave lithotripsy for the treatment of stones, they were randomized to either receiving Chanca Piedra, 2 grams a day for 3 months, or not receiving anything at all. Then they looked at them with an X-ray and ultrasound at intervals following their surgery to see if all the stones were gone. What's interesting is they found that the ones who had received Chanca Piedra had a stone-free rate of almost 93.5%. Compare that to the ones that didn't receive anything at all. They had a stone-free rate of only 83.3%. This was statistically significant, and this is important. More important, no side effects were reported from taking this stuff, so it's pretty well tolerated. Traditionally, people have used Chanca Piedra for other reasons. Although no scientific studies have yet proven it, people have used it for treating anorexia, menstrual problems, asthma, and urinary tract infections. If you have faith in traditional methods and traditional medicines, then there's not too many risks in trying this out. However, if you have any concern, you should definitely consult with your primary care doctor or physician before taking this stuff. Everything, unfortunately, comes with side effects. So let's talk about some of the side effects that can come from taking Chanca Piedra. It's been reported that it sometimes causes abdominal pains. It may not be the best choice for people who have sensitive stomachs. Remember that it also may help in lowering blood pressure. Kind of that thing that I was talking about, relaxing smooth muscles. Well, it might relax some of the smooth muscles in the blood vessels. Now, this is not a substitute for taking any type of antihypertensive medication. That's not what I'm encouraging at all. But because it does have this property, if you already have issues with having low blood pressure, then you might want to be careful, as it may lower your blood pressure. It might also cause blood in the urine and pain with urination. Now let's talk about how it tastes. Chanca Piedra is a herb, but it's not like the herb that you eat. This is a medicinal herb, so it actually probably tastes a little bit bitter. Chanca Piedra can be consumed in a tea form, or it can be consumed by pills. Now, does it really work? Again, if word of mouth or like one of your friends who said that this stuff really worked for them is good enough motivating force, then by all means try it. It seems like there's minimal side effects to it, and there may be some benefit. However, there's not much scientific evidence in the literature showing that it definitively works, and things that show that it does work have been just done primarily in animal studies. So there you go. These are the highlights that I pulled out for you about Chanca Piedra. You can decide for yourself whether you think this is something that you might want to try or not. Now, if you've already used it before in the past, I want to hear about your experience down in the comment section below. Don't forget to like this video and please subscribe to my channel if you haven't already.
Okay, that was about Chanca Piedra, but as you guys see from some of the research I've done right here, Chanca Piedra can be used. It's also called the stone killer because it removes gallstones, kidney stones, but here they're even telling you it can decalcify your artery. It's the strongest one. That's why it's position number 1. I found this from my own research off the internet for you guys, okay? Now, that's one video here. I'm going to show you a video on vitamin K2 next, how critical K2 is for balancing your calcium levels in your body.
I have had many requests to discuss vitamin K2. And so in this video, we will be answering the following questions. What does vitamin K do, and what is its role in the body? Who is at risk for a vitamin K deficiency? What are the signs and symptoms of a vitamin K deficiency? What are the dietary sources of vitamin K? And can vitamin K supplements interact with medications? If you stick with me till the end, I will show you a very recent study on vitamin K2 and its role in calcification and aortic stenosis that had some very interesting findings. Before we continue, I'd like to remind you that this video is not a replacement for medical advice. Please do not make any changes to your diet or medications without speaking to your healthcare provider first. There is increasing evidence that in some cases, our Western diet and the way that our food is produced may be leaving us more prone to different nutritional deficiencies. It is true that maintaining a diet that is complete with whole foods that you can cook and prepare yourself is ideal. However, this is not always the case, and this is not always the situation. We know that vitamins are essential nutrients. These nutrients are essential to maintain life and maintain many of the chemical reactions that our body needs to produce different life-sustaining proteins, for example. It is important to remember that vitamins are divided into those that are fat-soluble and those that are water-soluble. The fat-soluble vitamins include vitamins A, D, E, and K. And so vitamin K is the vitamin that we will be focusing on, this being a fat-soluble vitamin. It might be easy to confuse vitamin K with an element called potassium. These are two very different components. Vitamin K is an organic compound, whereas potassium, represented by K on the periodic table, is an inorganic element. So it's important to make this distinction before we go any further. So what does vitamin K do, and what is it good for? The original term for vitamin K comes from the German word coagulation, meaning the body's ability to clot or to prevent a hemorrhage. Newborn babies in particular are at higher risk for a vitamin K deficiency. And this is why when babies are born, they are quickly given a vitamin K injection in order to help prevent any tragic outcomes from hemorrhaging due to a vitamin K deficiency. It is important to note that our body does not store up large quantities of vitamin K, and the quantities of vitamin K that it does store, it seems to use quite rapidly. So we do need to acquire vitamin K either from our diet or from supplementation. When we speak of vitamin K, we are referring to a group of vitamins that are necessary cofactors for the production of many different substances and proteins in the body. These proteins are essential for maintaining adequate coagulation in the body as well as normal levels of calcium. Since vitamin K was discovered, we have learned that it plays a very important role in disease states like osteoporosis, vascular calcification, osteoarthritis, cancer, and even cognition. Vitamins that are part of the group of vitamin K vitamins include vitamin K1, phyloquinone, vitamin K2, menaquinone, which can be produced by gut bacteria, and the little known or lesser known vitamin K3, which is a synthetic vitamin that is currently being studied for different cancer treatments and is currently not available to the public. Vitamin K2, known as menaquinone 4 and menaquinone 7, are vitamins that are essential for the process of coagulation, in particular for the formation of the protein prothrombin. Prothrombin is a protein in the body that gets converted to thrombin when you, say, cut yourself, and this helps to aid in the formation of a blood clot. Without these important proteins like prothrombin and thrombin, you would not be able to form the clots that are necessary to help prevent bleeding in different places in the body, especially when you have a cut or another type of injury. Vitamin K also helps the body to utilize and strengthen our bones. According to Mount Sinai, research has found that people who have higher levels of vitamin K have greater bone density, while low levels of vitamin K have been found in those with osteoporosis. There are other studies suggesting that low levels of vitamin K may put people at greater risk for osteoarthritis. There is increasing evidence that vitamin K may help to prevent fractures in postmenopausal women who are at greater risk for osteoporosis. We also have evidence that vitamin K contributes to bone health in male and female athletes, and this is because vitamin K helps to activate a protein called osteocalcin. Osteocalcin plays a very important role in bone formation and mineralization, and this helps to strengthen bones and prevent fractures. Osteocalcin is the most important protein found in bone after collagen, and it is produced by cells called osteoblasts. Osteocalcin also acts as a hormone to adjust insulin and glucose levels in the body. It increases testosterone, aids in muscle strength, and it also helps with cognitive function. Let's discuss who is more at risk for developing a vitamin K deficiency. Vitamin K deficiency is fairly rare because we can acquire vitamin K through our diets, say through green leafy vegetables, or in many cases, our gut is also able to produce vitamin K. Those who are more at risk for vitamin K deficiency are usually people who have a low amount of vitamin K in their diet, or they have a malabsorption issue, meaning that they are not able to absorb enough vitamin K from their diet for their body to utilize. This includes individuals who suffer from alcohol abuse, general malnutrition, malabsorption, liver, gallbladder, and biliary diseases, celiac disease, and cystic fibrosis. It's also important to note that those who are already prone to a vitamin K deficiency and are given long-term antibiotics may be at risk for deficiency, and this is because the antibiotics are not selective and they can deplete the very bacteria that are responsible for producing vitamin K in the gut. Those who are on long-term hemodialysis and those who suffer from severe burns are also at a higher risk for vitamin K deficiency. There is also evidence that some patients who have Alzheimer's may be at a higher risk of vitamin K deficiency due to a lower amount of vitamin K in the diet. There is some research that suggests that supplementation with vitamin K in older but healthy adults may help to improve cognitive function. However, caution is warranted because supplementation with vitamin K can interact with medications, and we will speak about this in a moment. So what are the signs that you may be deficient in vitamin K? The daily requirement for vitamin K for women is 90 micrograms a day and 120 micrograms a day for men. Though deficiency is considered to be rare, a vitamin K deficiency may present in the following ways: a prolonged prothrombin time, and this can be measured with a very simple blood test; unusual bleeding, easy bruising, or gums that are bleeding quite frequently. This could also be caused by other things, but it could be a sign of vitamin K deficiency. Hemorrhaging, osteopenia, which is a condition where there is lower than normal bone mass or bone density, and even osteoporosis. What type of foods contain vitamin K? Vitamin K1 is mostly found in plants and is our main dietary source of vitamin K, whereas vitamin K2 is found in fermented foods and some meats and cheeses. Foods that contain a significant amount of vitamin K include broccoli, kale, spinach, asparagus, and dark green lettuce. Beef liver, green tea, and turnip greens are also abundant in vitamin K. Chlorophyll is the substance in plants that gives plants their green color and is abundant in vitamin K. Finally, vitamin K can also be found in soybean and canola oil, fortified meal replacement shakes, and the menaquinones can be found in natto, which is a type of fermented soybean, as well as smaller amounts that can be found in meat, cheese, and eggs. It is very important to note that freezing foods can destroy the amount of vitamin K in that food. However, heating or cooking foods does not seem to destroy vitamin K. It really is not difficult to ingest adequate amounts of vitamin K daily. In the video description below, I will give you a chart that shows you the amounts of vitamin K found in different foods. You will see that just half a cup of beets will provide you with 368 micrograms of vitamin K. So this goes back to the importance of maintaining a healthy diet full of whole foods that you can cook. This ensures that you will get enough vitamin K daily. So if you are considering supplementing vitamin K, A question you should be asking is, can vitamin K interact with medications? And the answer is yes. A change in diet that results in excess intake of vitamin K from dietary sources can interact with a group of medications known as oral anticoagulants. In this case, the medication that we are most concerned with is warfarin, otherwise known as Coumadin. Vitamin K supplements should not be taken while on the medication warfarin. However, if you are already on warfarin and taking vitamin K, please do not make any adjustments without talking to your primary care provider first. There are, however, newer medications that are being used with increasing frequency that do not have this type of interaction with vitamin K. Another medication that can interact with vitamin K is the antibiotic family cephalosporins. If a person is given a cephalosporin like cephalexin or Keflex or cefuroxime, there's a whole family of these medications, for more than 10 days, this could leave someone who is already prone to deficiency to be deficient in vitamin K. We know that patients who are given antibiotics for longer terms are more prone to deficiency. Another medication that can leave babies more prone to vitamin K deficiency if their mothers are on this medication is called phenytoin, otherwise known as Dilantin. Now, vitamin K does not cross the placenta and it does not cross into breast milk in very high amounts. And mothers who are on this medication are more prone to deficiency in the first place, meaning that their babies will get less vitamin K from the mother. And so this needs to be monitored by a physician. There is another medication that is often used for weight loss, and it is a bile acid sequestrant that we know as orlistat or Xenical. This medication helps to reduce the amount of fat that the body is actually absorbing. In doing this, it also reduces the amount of fat-soluble vitamins, vitamin A, D, E, and K, that the body is able to absorb. So this could leave someone more prone to a deficiency if used over a long period of time. Now, there's a very interesting study that looked at the supplementation of vitamin D and vitamin K versus placebo and cardiovascular health. They looked at whether this type of supplementation could help to prevent the progression of calcification in patients with aortic stenosis. Now, this was a multi-center, double-blind, randomized trial. It was a very high-quality study. This trial looked specifically at men who had evidence of aortic and coronary artery calcification as verified and monitored by CT scan. They looked at whether giving patients either a placebo or vitamin D with vitamin K2 would help to prevent the progression of calcification. The men were divided into two groups and given either placebo or 720 micrograms of menaquinone 7 plus 25 micrograms of vitamin D. These patients were then monitored over a period of 24 months. Though this trial noted that there was no significant difference in the progression rate of calcification in those treated with vitamin D and MK7 versus placebo, they did, however, note that there was a significant reduction in a particular protein known as dephosphorylated uncarboxylated matrix GLA protein in the MK7 plus vitamin D group, this being a biomarker of functional vitamin K status. We do know that high plasma concentrations of this particular protein are a reflection of poor vitamin K status. There is definitely a need for more high-quality research on the benefits of vitamin K2 supplementation. Fortunately, for most healthy adults, we know that dietary intake of vitamin K2 is quite easily attainable. Though some vitamin D supplements are already coming with the addition of vitamin K2, it's particularly important to ask your healthcare provider before taking any of these supplements, in particular if you are already taking other medications or supplements that could interact. This will also give you information as to when you should take the medication so you can properly absorb this and get the most benefit from your vitamins and supplements. If you like this video, don't forget to give it a like.
Okay, so as you guys see, she showed you there's a link to being almost calcium deficient and having calcified arteries, okay? And again, vitamin K2, as she stated, helps to balance calcium levels in your body. Here's the last video for you guys. And again, I'm going to put links to everything from the supplements to links to these videos I'm sharing with you guys in here. Now, I know I'm playing these videos at a faster speed, so they're talking very fast in these videos. If it's hard for you to understand it, I'm doing it so we can get through the video faster. If it's hard for you to understand, there's direct links to all these videos in the material I'm sharing with you below the video, okay? Here's the last video with you guys. Again, these videos, this doctor right here is going to be very confirming on showing you how K2 is linked to they're going to show you how there's a vitamin K2 deficiency linked to excessive calcium in the body and or clogged arteries. Here's the video.
Well, hello everybody. Today, it gives me great pleasure to talk to you about calcium. This has been a point of interest since I was a fellow, because we all know that calcium seems to be what's plugging up the arteries. So I have an interest in calcium, and with it, vitamin K2. So what is vitamin K2? It's a vitamin that's unheard of. K1 maybe, but K2? So today, I'm going to teach you about calcium and vitamin K2 and why I'm so interested in it. Because I think that this is a very important chapter in our understanding of what's causing blockages in the arteries of the body. So let's just dive right into it. So, as a fellow, I noticed that heart disease, blockages in the arteries, seems to go along with diabetes, right? High blood pressure, degenerative joint disease. These patients have arthritis. Many of them are very overweight. Bad teeth, bad gums, and dental decays seems to go along with coronary artery disease. And I always wondered, why is this the case? There's something going on with the bones, and they all have osteoporosis. So why do coronary patients go along with osteoporosis? They come to me because they get hip replacements, they get knee replacements, and I often wonder, what's that got to do with heart disease? Why is it that heart patients are getting joint disease, or vice versa, patients with bad bones and osteoporosis?
If you have an enlarged prostate, do this 15-second Japanese ritual before
Hold on,
bed to
guys.
shrink
Here's
it almost
a
immediately.
horrible. Okay.
They're getting coronary artery disease. As I started doing the research, I started reading about calcium. And I started noticing that because of the bad bones and osteopenia, everyone was on calcium supplements. And then the studies started coming out that the calcium supplements that you take for your bones and for general health are actually increasing mortality. So there's numerous studies that show that if you take more than 1 gram of calcium supplement on a daily basis, increases cardiovascular risk by 20%. Now, if I had a drug that reduces your cardiovascular risk by 20%, I would definitely give it to you. But here I have a calcium supplement that increases your risk by 20%. But nobody's talking about this. This really got my interest. Why is it that calcium increases the risk? So we looked into it. The Women's Health Initiative study was a huge study, and it showed that 1 gram of calcium, elemental calcium supplementation, increased mortality between 15 and 22%. Increase your mortality, taking a calcium supplement. And this was with or without vitamin D supplementation. And we found that in renal failure patients, they were constantly given calcium supplements as well. Their risk increased by 22% just by taking calcium every day. And yet they were thought that they're taking calcium because they don't want to get bone disease, they want nice strong teeth, they want to have strong joints and hips, but no. So what is it about calcium supplementation? Well, one of the things we thought that it may increase clotting, because if you want a blood sample to clot, what do? You put some calcium in it, right? And it clots. Another thing that it can do is cause high blood pressure. So we know the higher the calcium levels, it can cause high blood pressure. But these patients were not having high blood pressure, even though they were taking the calcium supplements. So we were not sure why calcium supplements do this. So now my recommendation to everyone is do not take calcium supplements unless there's a good reason to do so. Speak to your physician about it. But just don't take calcium, because calcium supplements are available over the counter. So there's something else that's got to do with calcium metabolism. And today I'm going to tell you that the answer is probably vitamin K2. So what is vitamin K2? Vitamin K2 is a fat-soluble, it's a fat-soluble vitamin. That means you cannot absorb it into your body unless there's some fats available. And vitamin K2, assume for now that it's got something to do with good bone metabolism, that you need vitamin K2 for strong bones. So what's going to happen if you take vitamin K2 away from your body is you're going to get bone disease. Why would you get rid of vitamin K2? Why do we have vitamin K2 deficiency? Why would I even think anyone's got vitamin K2 deficiency? And I'm going to teach you today that you get vitamin K2 deficiency because of the lifestyle changes we've made. Because it's fat soluble, and now we're on a low-fat diet. For the past 40 years, we've had this experiment, and I'm sure you've all looked at my YouTubes that clearly shows you that this thing about the low-fat diet is not very good advice. Because with it came vitamin A, D, E, and K deficiencies. With these vitamins, you just need small amounts in your bloodstream to have a tremendous effect. And when we go on these odd diets, such as all these low-fat diets, you're not going to absorb those vitamins. And that's exactly what we've been finding. So let me tell you a little bit more about vitamin K and how this all fits in together. So in your bone, for example, you have 2 types of cells, the osteoclast and your osteoblasts. The osteoblasts, they build up bone. That means they take calcium from the bloodstream, push it into the bone. So you get nice, strong bones. Osteoclasts, they destroy the bone. So they destroy the bone, they demineralize the bone. They take the calcium out. So the way it works is that you need osteocalcin to bind the calcium, but to activate the osteocalcin, you need vitamin K2. So if you do not have vitamin K2 in your body, you're not going to get carboxylation of these chemicals called osteocalcin. And this in the tissues, the counterpart of that is called matrix GLA protein. So this protein has to be activated by 2 things, vitamin D and vitamin K2. Now in the tissues, this chemical does a different thing. It takes calcium, binds to it, and moves it into the bloodstream, out of the tissues. So in the bone, it causes deposition of calcium, but in the tissues, it pulls calcium out of the tissues, takes it into the bloodstream so that it can then head on off to the bones. So these matrix GLA proteins, what are they doing in the tissues and where are they being produced? They're produced by the smooth muscle cells of the blood vessels. So the blood vessels, they have smooth muscle cells. That's why they can vasodilate and vasoconstrict. They make this protein. This protein has to be activated by vitamin K2. When it's activated, it'll bind calcium and move it out of the blood vessel. When vitamin K2 is not there, there's nothing to take the calcium out of the blood vessel. When the vitamin K2 is not there for the bone will not be able to mineralize because that particular protein in the bone binds to hydroxyapatite and then the calcium gets trapped in the bone. So you would expect that vitamin K2 deficiency is going to cause calcification in the tissues, the blood vessels, and causes demineralization of bones. So it causes osteopenia, and that's exactly what we've been seeing. You get more degenerative joint disease, more osteopenia, and more calcification where you shouldn't find calcification. Blood vessels should not be becoming ossified. So what's happening is that the total body calcium is actually pretty good, but it's all in the wrong places. And calcium supplementation doesn't help because calcium supplements, they just don't end up going to the bone. You need chemicals, you need hormones, you need enzymes and cofactors to put it in the bones. So vitamin K2 deficiency, this seems to be a very strong link. And there's two types of vitamin K, vitamin K1 and K2. So K1 has to do with coagulation. That's why we missed this for a long time, because we thought vitamin K is vitamin K. Actually, did you know that there's 10 types of vitamin K? There's 1 all the way to 10, but the important ones are vitamin K1 and vitamin K2. So K1 has to do with coagulation. And if you want to antagonize that, you take Coumadin. So it's a blood thinner. How does it work? It antagonizes vitamin K1. What about K2? Well, if you take Coumadin, you antagonize K2 also. So does that mean that when you're giving Coumadin or blood thinner long-term to a patient, is that patient going to have vitamin K2 deficiency also because you're antagonizing it? And then says yes. And I've known personally for 30 years that patients who are on Coumadin, they get calcification of the arteries. They get calcification of the aorta, they get calcification of the valve, they get calcification of the coronary artery. So we knew that years ago, but it took us 30 years to piece all this puzzle together. And now we know that Coumadin patients have a problem because they have not only low vitamin K1, which you want because they don't want their blood to clot, but you also have vitamin K2 deficiency. So where does K1 come from? K1 comes mostly from chloroplasts. So anything green, leafy vegetables, algae, that's where vitamin K1 comes from. So where does vitamin K2 come from? Now there are two sources of vitamin K2. One is animal sources, and the other one is my favorite, fermented products.
This simple 30-second method reverses
Hold on, guys. I'll get rid of this
loss for
commercial.
good. It's so easy.
See, it's all coming together. Why I've been encouraging fermented products. So let's look at vitamin K2, also known as menaquinone. Animal one is called MK4, and the one that comes from the fermented products is called MK7. MK7 is a longer molecule. It is biologically more active as well. It is found in some meats, some eggs, dairy, and fermented products. So vitamin K2, why would vitamin K2 deficiency happen if people are eating lots of meat, eggs, chicken? Because the quality of the meat is also going down. If your animal was not eating green chloroplasts, green natural grass foods, that meat is not going to have enough vitamin K2 also. The eggs are supposed to have a lot of vitamin K2, but today's eggs are all fed grains, and grains don't have vitamin K2. Vitamin K2 has to come from the original product, which means nature. Nature has to provide it first. So when it goes through the cycles of the animals, that's when vitamin K2 levels go up. Fermented foods make vitamin K2. The fermentation products make vitamin K2. So vitamin K2 gets into the body, it activates all the MGPs, and in the bones, you're going to get strong bones, and in the blood vessels, you're going to get inhibition of calcification. So now can we measure vitamin K2? If this is so good, then why can't I just go in and get a vitamin K2 level? Why can't I just do it? Because there's no method to do it. So what we look is non-carboxylated proteins. And that's a test you can do, but it's not available right now. It's only being used in research purposes. And that's how we get all this information together. There was a huge study done, and you can see the references, I'll show them to you, that we correlated the non-carboxylated proteins, which tells you that you got vitamin K2 deficiency, and correlated to the amount of calcification in the arteries. And there's a direct correlation. The more non-carboxylated MGLA proteins that they are, more the calcification in these arteries are. So this started really making us think that, my God, we do have a problem here. So then they did another study in Europe. It was called the Rotterdam study. And in the Rotterdam study, they took patients, males and females over the age of 55, thousands of them, and they looked at the vitamin K2 intake. And they listed the vitamin K2 intake that each patient had, and then looked at outcomes over the next 8 years. And they found that aortic calcification, coronary artery disease, but also all-cause mortality were directly related to the vitamin K2 intake. More vitamin K2, lower the mortality, less coronary artery disease. Now, you may argue that, oh, well, maybe it's the food rather than the K2 itself. And that's a possibility. But at least we're beginning to see a correlation over here. In the studies found that if you consume more than 32 micrograms of vitamin K2 a day in your diet, there's a 50% reduction in cardiovascular death. Now you've got my attention as a cardiologist. And a 25% decrease in all-cause mortality. Why is all-cause mortality also important? That means it's not just decreasing heart attacks, it's also decreasing other things too, other causes of mortality, which may include some cancers. And there are studies showing that vitamin K2 supplementation reduces certain types of cancers, and I'll come to that if we get a chance here. If you like this video, then this one I strongly recommend it for you. If you want to see the whole series,
So as you guys see, again, I've got links to all 3 videos and supplements ranging from vitamin K2, vitamin D3, complements K2. Okay, so I recommend you do K2, D3 with K2. I've got a link for Morenga. Okay, I've got all this in there and links to all these videos. But again, I'm not a doctor. I'm not a health professional. Consult with your doctor before doing anything I've shared. And again, I've shared what I've shared because it's corrected my health. I'm absolutely pain-free. Felt led to share this with you guys. So here you go. Here's some powerful health information. As you see, calcium is the root cause of most diseases. Enjoy your evening, guys.